Hello, we are today with Kimberly. Kimberly is my patient. She had 6-year history of biopolymer or liquid silicone injections in the buttocks in New York for a nurse. She experimented some symptoms about their general issues like memory loss, some things like she will spoke to everybody and explain better than me, and she undergone a procedure, open technique, in the buttocks, in the thighs, a very complicated surgery, but the post-operatory period was a little difficult, but now is very good condition, and she will come back to her country. And Kimberly, tell us how was your history, your surgery, your recovery, and how do you feel today?
Well, probably like last year in 2017, I started having, my legs started inflaming, and so I went on to search for a surgeon, and I found Dr. Rios. And I contacted lady on WhatsApp, and when I contacted her on WhatsApp, she told me, I told her what was going on, what I had, that my leg had inflamed and all of that, and I was looking for a doctor, and she went on to tell me that he was, what it was. She sent me emails telling me what the procedures was and all of that. So then I kind of like waited for a second, and then I came back this year in 2018, and I had inflammation again. This time the inflammation this year was worse than it was last year. So when it came up this year, I was like, okay, well, let me hurry up and get to Colombia to Dr. Rios. Once I got here, I came and I got in like on a Friday. I saw him like that, came in Saturday. I saw him again on Monday, and then Tuesday I had surgery. When I spoke with Dr. Rios, he told me that he was going to do the open procedure or whatever because it was more silicone in my thigh area than it was in my buttocks. So once he went in and he took it out or whatever, and after the surgery was done, the actual incision that was supposed to be there is there, except I have an additional incision, which is fine with me. I came to be healthy, not because of a scar or anything like that, so I really didn't care. Yeah, so I mean, I'm here. It's been 2 weeks now. I have like a couple of more days or so, but so far I had no pain, none whatsoever. I literally walked out of the hospital. I didn't know for the first couple of days that I wasn't supposed to sit down, but I sat down and I had no pain then, but I know that you're not supposed to sit down after you had a procedure done. But so far so good.
But that order for don't sit down is only for prevent the wound open.
Right, okay? Right.
You could sit down, but we try to prevent that.
Oh, okay. So I could have said could and could not, but it's fine. Other than that, it's been, I mean, the recovery has been really good. My wounds are like, the lines are like really, really fine. I can tell that once they're completely healed up, and I won't be able to see it. So that part, I'm fine with that. It's not like if it would have been an issue that I would have had one. So I'll see what happens 6 months to a year down the line, really probably 6 months. And then I'll come back if I need to have any reconstruction or whatever. But I don't think I'm gonna have to, so. But he's amazing. He is. I'm not saying it because he's telling me to say anything or anything like that. I just want people to know that when you have this done, don't expect for this outcome to be, let me see. Don't choose vanity over health. Don't do that. When you need a doctor, do this right here.
Okay, this procedure we try to explain to the people, to the patients, to our patients, and the patients come to see us or write to us that this is a very complicated surgery that has more risk than other aesthetic plastic surgeries. This is a reconstructive surgery. We don't remove the aesthetics of the surgery because this is not non-relationship with the aesthetics, with the final result of aesthetic. We are looking for health. We have ill patients that had a lot of pain or same symptoms, and that is we are looking for to give healthy lives to the patient with a lot of problems. So if you are looking for aesthetic, I am not your doctor. If you are looking for healthy life, I am pleasure of be your doctor. But I love patients like Kimberly that are completely certainly about the kind of surgery she are looking for, and is not worried about aesthetic. But that is important, I know it. But the most important thing is the health, is the life, and that is the message I want to give to the other patients, people that want to come here to make some surgeries. Kimberly studied medicine. The first years of school medicine, she understood everything. She is so clear about the kind of surgery she wants. It was amazing because she was so clear about her condition and her surgery and what she expects. Now she feels better, she's okay to come back to her country, and I never make promise of garden rose.
Yeah.
This is a hard work, this is a hard way, and we are here to give the better of us, and sometimes there are complications, open wounds, infection, necrosis, that is the seroma, that is the more common complications, and we are here to help you, but always is the patient. The easy part of the surgery, the hard part is the post-operatory period, and everything was okay with her.
Yeah, everything was fine. But let me say this, because people have to understand this. You got to understand that when you have this done, don't ignore itching. Don't ignore that. Don't ignore the fact that your skin feels dull. Don't ignore the fact that, oh, I just put something down and I don't know where I put it at and I'm too young to be forgetting. Don't ignore that. Don't ignore that when you wake up, your hands may be tingling or your fingers may be tingling or whatever. You can go to the hospital and the hospitals will tell you, oh, you're fine. Oh, it's nothing. You know what I mean? Don't ignore that because there's something wrong. And the signs, let me tell you, your body gives you signs before the infection sets in, before any inflammation sets in. Your body warns you first. And if you ignore the warning signs, then eventually you come out with complications like your skin discoloration and him having to remove your skin and not just what's on the inside. You don't want to walk away and end up deformed because your body told you at first what was going to happen and what was happening to it. So please, 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 don't be scared if your doctor tell you, oh, I'm going to have to cut you open. Let the doctor cut you open and take it out. You would rather the doctor cut you open instead of your family having to bury you or your kids losing you. So this is very, very serious, and it's been going on for a long time. And there's a lot of people that's scared to say something because they're scared for their friends to know what they really done or their spouses to know what they really done. Forget that. Get it out of your body and live your life, and don't lose your life because you want to look good and because, oh, my butt looks good. No, you can look better going, having it taken out and having reconstructive surgery done and having them to do fat transfer, which is your body, and your body will not reject you. Thank you. Thank you so much. I didn't mean to cry. I didn't mean to cry, but it just, you know, it bothers me.